head to toe assessment. I'm going to go ahead and palpate the cranium from the frontal lobe all the way to the occipital. I'm going to check my blood with my hands for any blood on my fingers. I'm going to look in both ears. I'm looking for cerebral spinal fluid or any blood. I'm going to check the nose for the same thing. I'm going to open the mouth and look for good oral hydration or any dentures that could possibly occlude the patient's airway. Then I'm going to assess the eyes to see if they're reactive to light. Once I've assessed it, then the proctor, because this is an assessment, they will give you a finding that the eyes are pearl, pupils are equal, reactive to light. Then I'm going to check the neck, and I'm only going to check the neck for jugular vein distension or tracheal deviation. If there is a finding, the proctor will let you know at that point. Without unnecessary exposure to the patient's chest, I'm looking for bruising, areas of flail, or scarring. I'm going to check the integrity of the sternum and the equal rise and fall of the chest. I'm going to now check for lung sounds. If there's a finding, the proctor will now give that to you. Without unnecessary exposure to the patient's abdomen, I'm looking for bruising, areas of flail, or scarring. I'm going to palpate all 4 quadrants. If there is a finding, the proctor will let you know at that time. I'm going to check the iliac crest, the pelvis, down and together once. And if there's a finding, the proctor will tell you that at that time. I'm going to check the genitalia area on a female. Even though I know this is a male, I'm looking for bloody discharge in excess of 1,000 cc's or priapism caused by a neurological event. Then I'm going to go to the lower extremities. You can do it one of 2 ways. You can go down here, both, as long as you can reach both, and you have to take off one, we're not going to do tonight, take off one sock and shoe on one of the legs. Then you're going to feel for bilateral pedal pulses. Does everyone know where the bilateral pedal pulses are? Bilateral meaning both. Pedal pulses, there's a firefighter way where they put the palm of the hand here and they feel out this way. That's one way you can do it. Generally speaking, that's on an average sized foot. Some of you that have smaller feet or some of you that have bigger feet, that's not going to work. So the pedal pulses is generally on the instep right about here. Okay, we'll play with it later. You want to check bilateral pedal pulses and move on from there. You want to go to the upper extremities, decap VTLS, and if you can reach on the other side safely, do the same thing. Check for bilateral radial pulses, and if there's a finding, the proctor will give that to you as well. At this point, I want to log roll my patient. Now, we haven't done this yet, but we're going to show you right now. Take the arm closest to you and put it above their head. Take the leg farthest away from you and cross it over the patient's body. Take this arm and make sure it's secured out of the way. You want to position yourself between the shoulder and the hip. You don't want to get right up against the patient because once you roll them, you're not going to be able to do anything. You want to be a couple of inches off the patient's chest wall. So, before you even move them, you have to indicate, before I log roll them, someone's going to maintain C-spine precautions, and then we're going to roll on the count of the head, and then just count for yourself. 1, 2, 3. Then I'm going to roll them here. I'm going to keep them in this position. I'm going to use my body as a fulcrum. Then I'm going to go down the buttocks area. I'm checking for pulling. Then I'm going to go up the spine for any muscle spasms or splitting. Then at the count of 3, 1, 2, 3, I'm going to log roll back this way. Okay? And that's it. Okay? Thank you. Okay, same rules apply. Girls, guys, I mean, it's really up to you. It's the integrity of your morals and ethics. If you're into that kind of crap, do it somewhere else. But if someone's taking liberties with your body, you need to let me know, let one of the proctors know. And I assure you we'll do everything we can, okay? You don't need to be subjected to crap like that. All right, so again, I'm going to go ahead and palpate from the frontal lobe all the way back to the occipital. Check my hands for any blood. I'm going to check her ears. Don't move your head. Okay, for any cerebral spinal fluid or blood, I'm going to check the nose for the same thing. I'm going to open the patient's mouth, look for good oral hydration or any dentures or teeth that could be causing an occlusion to the throat. I'm not going to hit you. And I'm going to check the eyes for reactivity to light. Then I'm going to look at the neck. I'm going to check for tracheal deviation or any jugular vein distension. Without unnecessary exposure to the patient's chest, I'm looking for bruising, areas of flail, or scarring. I'm going to check the integrity of the sternum, and I'm going to check the rise and fall of the chest wall. Then I'm going to get my stethoscope and I'm going to listen to lung sounds. Without unnecessary exposure to the patient's abdomen, I'm looking for lacerations, penetrations, or eviscerations. I'm going to palpate all 4 quadrants. Then I'm going to move down to the pelvic area. I'm going to check the iliac crest, press one down and in together. Check for stability. Then on a female, I'm going to look for bloody discharge in excess of 1,000 cc's, or on a male, a priapism caused by a neurological event. Now I'm going to go down to the lower extremities. I'm going to decap VTLS all the way down. During test time, I'm going to remove the sock and shoe, but for these purposes, we're not going to do it right now. Then I'm going to check for bilateral pedal pulses and move on. I'm going to palpate the upper extremities. I'm going to check for bilateral radial pulses. And if there's a finding, the proctor can give it to us at this point. Then I'm going to go ahead and set up for my log roll. The arm closest to me above her head, the leg farthest away from me across her body. Secure this arm over here. Position myself between her shoulder and her hip. Before I log roll her, I'm going to indicate to someone, my proctor, that someone's holding ceasefire precautions. On the heads count, we're going to roll her. 1, 2, 3. Log roll this way. We're going to maintain this position, go down, check for pulling in the buttocks. Then I'm going to go up the spine, check for any muscle spasms or splitting. Count of 3. 1, 2, 3. Log roll her back. Okay? Thank you.
What is the muscle spasm feel like when you're going? What do you
You're going to see them. They're going to be pulling. They're going to spaz like this. Like you've ever had like a jerk motion, like a not Tourette's, but some kind of uncontrolled muscle movement.